Hello, my name is Nick Andrew. I'm an eye surgeon based in the Gold Coast, Australia, and have specific expertise in surgical vision correction and glaucoma microsurgery. Now, are you wondering what cataract surgery costs in Australia, or are you having difficulty understanding the different fees you've been quoted? Don't worry, this is very common. Cataract surgery fees can indeed be very confusing, so I've made this video to help. The costs of cataract surgery in Australia include 10 separate components. These are the fee for your initial consult, the fee for your eye measurements, which is called biometry, the surgeon's fee, the anaesthetist fee, the hospital fee, the fee for the lens implant, the cost of any post-operative eye drops, the cost of your post-operative clinic visits, and the cost of a YAG laser capsulotomy. And finally, any surgical revisions and adjustments, although hopefully these are not required. If you are uninsured, then you will need to pay for these items. Fortunately though, Medicare will also contribute. After you've received your Medicare rebates, you'll be left with an out-of-pocket amount of somewhere between $2,000 and $6,000 per eye, depending on the treatment you are having. If you have private health insurance and your policy includes cataract surgery, then your insurance will cover most of these fees for you. You'll have to pay the excess on your policy, and there may also be a gap payment, but your insurance will bring down the cost of your care by several $1,000s per eye. Now, this all seems fairly straightforward, so you might be wondering, how can this topic cause so much confusion? Well, cataract surgery fees can get confusing for a couple of reasons. Firstly, different clinics charge very different amounts for some of these fees. One clinic might be cheaper for their surgeon fee, but charge a lot more for the hospital fee. Another clinic might have a high surgeon fee, but charge less for all other fees. Because clinics organize their fees in different ways, what matters is the total out-of-pocket that you pay for your entire treatment journey, from initial consult through to final discharge. One of the most common ways that patients get caught out is with the cost of YAG laser capsulotomy. This is a simple, painless procedure performed in clinic to polish the lens capsule inside of your eye. Almost everyone having cataract surgery will need laser capsulotomy performed a couple of years after their surgery. Some clinics charge their cataract patients as much as $2,000 for their YAG laser capsulotomy, whereas many other eye surgeons don't charge their patients anything at all for doing this procedure. This is a massive cost difference between clinics, and is therefore something that you should ask about when scheduling your surgery. When assessing fees, the thing you must also compare is quality. Make sure that you are comparing apples with apples. Many patients assume that cataract surgery is a standardized procedure and their post-operative vision will be very similar no matter where they go. But the truth actually couldn't be further from this. With cataract surgery, there is an enormous difference in the way that eye surgeons plan cataract surgery, select the lens implant for your eye, and perform the operation. What matters most is your post-operative vision. Cataract surgery is one of the most impactful things you will ever do for yourself, and it's worth doing well. In my experience, within a few months, patients usually can't even remember what they spent on their surgery, and all that matters to them is their result. So to summarize, cataract surgery fees can be confusing. My advice is this: make sure that you are inquiring about the total cost of care for the entire treatment journey. And make sure that you are comparing apples with apples, as your result is what will matter to you most, and your result is what you keep for the rest of your life. I hope that helps to make things clearer for you. I wish you all the very best on your journey towards better vision.